Hello, hello, hello. Sorry I am late. Welcome to the Eclectic Experience. I am your hostess with hopefully the mostest. I am Shy Rosalind and welcome. Tonight is a special episode. I normally do Friday Funny News, but I decided since I did quite a few videos on healthcare disparities in the U.S. and my latest focus was on women because we have an issue with maternal death rates and all that. But tonight I decided to do something for the fellas. So fellas, this is for you. And before we get started, of course, please like, subscribe if you're so inclined, and share with a friend or two or three. It would be greatly appreciated. I'm not monetized yet, but I'll get there at some point. I will get there. I do have a Cash App running along the ticker. If you're interested, you can go ahead and do that. But in the meantime, comments are welcome. Likes are always appreciated. Subscriptions are always free. And thank you to my latest subscribers. I appreciate y'all very, very much. So thank you for joining me tonight. And if you are watching on the replay, welcome. And just let me know in the comments that you caught me on the replay. So, all right. So let's get into it. I did a little research, did a little digging, and there's a lot out there about the healthcare disparities in this country for black people as a whole. And that could literally be a whole other topic by itself. And there's plenty of information, but I tried to narrow it down to black men because let's face it, fellas, y'all dropping like flies. I'm just gonna keep it 100. Y'all dropping like flies. Y'all get sick. We don't go to the doctor. All that good stuff. Well, not so good stuff actually. And so I wanted to touch on that tonight and encourage my brothers to please get checkups, dentist checkups, medical checkups. Don't end up in the ER. Trust me, you do not want to be in the ER. So anyhow, what I'm going to do, of course, I have to say, this presentation is not specific medical advice. If you are experiencing a medical condition or suspect that you might have a medical condition, go to a doctor. Go to a doctor. If you do not have medical insurance, you might be eligible for some kind of assistance, either Medicaid or subsidized insurance, so you can at least get a checkup. So, just to say that. And then also, as usual, my fair use notice. I might show a clip or two tonight. So, of course, I'm putting up fair use notice. Let's see. Okay, so we got that out of the way. Let me pull up the clip I want to show you. Let's see. Give me a second, y'all. I have this queued up. I just want to, yeah, here we go. This is what I want to show y'all. This was a news report that this gentleman did. I think it was last year. I'm going to go ahead and share the screen. I think it was last year. 7 months ago. Okay, it was this year. And I'm just gonna play this. It's 3 minutes, so hopefully everyone can hear it. And here we.
Primary care can be a self-imposed death sentence, especially for Black men. That's a powerful statement, but doctors confirm it's true. As a group, Black men have the lowest life expectancy in America. So the question becomes, why do so many Black men avoid primary care even when they don't face barriers to healthcare like insurance and cost?
I think men in general when you look at men in general, they're less likely to be forthcoming with their health issues. That becomes more compounded, particularly in African Americans who haven't historically had that relationship with providers.
Our expert is Dr. Kelly McCants. He's the executive director of the Norton Institute for Health Equity, a heart specialist and an HBCU grad.
We tend to trust people that look like us, where we can have a comfortable conversation about things that we may be embarrassed about, or that we may be uncomfortable with, or that we may not know about. And guess what's at the center of that? Your health.
Heart disease, cancer, stroke, diabetes, kidney disease, and hypertension are among the top killers of Black men. These illnesses alone are solely responsible for the loss of generations of Black men.
If we could control and prevent hypertension, all of those other things that you mentioned would go away. But when it comes to cardiovascular disease and kidney disease, if you control the blood pressure, particularly in African Americans and African American men, those things are less likely to cause what we call in organ damage, to the point where you have a stroke, you end up on dialysis, or you have a heart attack. And so a lot of it's preventable if we catch it early, have those uncomfortable conversations, and make sure people adhere to medicines.
I said something in writing, and a lot of people have gone back and forth saying, oh, you're just being dramatic. I'm going to say it to you and get your reaction.
Sure.
Actively dismissing primary care is a self imposed death sentence.
That's strong. That's a very strong statement, but I think it's a powerful one. If you don't have a relationship with a provider that you have had throughout your lifetime, those people have a life expectancy that is clearly shorter than those that do.
Well, our work doesn't stop here. We're going to continue this series. And as we move through this effort, we're going to look at some of the resources that are available to help ensure access to primary care right here in this community. In the meantime, if you've not seen a primary care doctor in a while, it's my hope that you'll make an appointment, because you are worth it. One way to find one is by visiting nortonhealthcare.com/location/Norton Primary Care. And I want to flag something that Dr. McCann said. If we can control hypertension alone, that one thing, all of those other ailments either go away or are diminished somehow. Full disclosure, I'm medicated for hypertension. When I started working with my primary care doctor years ago, it was the first thing he flagged and said, we've got to tackle this first, and then everything else, will be manageable.
Right.
And he was right. He saved my life in that one visit to the doctor. So what's it going to take to get people to recognize that this is critical?
Absolutely. And Eric's done a ton on this. You've got a bunch of different resources on your social media pages, your Facebook, your Twitter, all that stuff. So I really encourage anyone who might have questions to go ahead and check out those resources as well. And I'm excited to continue this conversation.
Thank you.
Live streaming can be tricky.
Okay, so I wanted to start with that because it's recent, and it basically breaks down it's a basic breakdown of the situation. We black folks don't necessarily trust our doctor. We don't trust doctors that don't look like us that easily. Now, my personal experience, as I pull up the next thing I want to pull up, is my personal experience is a little different. I've had doctors from different countries, and some of my doctors have been really, really good. Some of them, I'm glad I never have to see them again. Um, so, actually, the funny thing is, I've had the best actually, honestly, the best experiences I've had with doctors are Russian doctors. For some reason, Russian doctors, they they break it down. They don't mince words. They break it down. But it's just odd. But I mean, I've had doctors from all over the world. I've had black doctors, white doctors, Indian doctors. Um, And it's like I said, my experiences are obviously they're different because I'm a woman, but um, there have been doctors that I'm like hands down. I will tell my friends go see this doctor, and there are doctors where I'm like, who? I won't recommend them. I won't bash, but I won't necessarily tell anybody to go see them. So, and speaking of finding a black doctor, I'm going to share this next. Okay, so we have blackdoctor.org, and they have. Let me just change this for a second. There we go. So they have a bunch of they have articles, they have wellness tips, they have a find a doctor. You can find your doctor by zip code and the type of doctor you're looking for. They have resources for different, they have a cancer resource, COVID, clinical trials. They have you can search by a specific condition and it'll give you like a whole bunch of information. Let me scroll so y'all can see. So it's in alphabetical order. Um, so they have all this good stuff in here, and let's see what their wellness is. I didn't check their wellness. Come on, there we go. They have they have for babies, eye care. So they have a whole bunch of stuff. So blackdoctor.org. And you can search if you know specifically want a black doctor. This is a good place to start your search. Let's see what else I wanted to show you guys. uh I had these. Thank God I wrote notes. I have a little notebook with my notes. And when I do my research, I do my research on my desktop. Because it's just a bigger screen, it's easier for me to search. And then I usually either write down the website or since of course I use Google Chrome and I have my laptop as a Chromebook, usually I can just pick up the bookmarks on my Chromebook. And of course, tonight, no, no such luck. Can't pick up my links. So I have to search a little bit, but definitely go to blackdoctor.org. I would go there first. And then I'm going to. I had some statistics that I wanted to show. Oh, here we go. Okay, so I'm gonna stop this one. And I'm going to flip. Bear with me. Wait a minute. Okay, we did that. Okay, I think this is it. Okay, so this is Very Well Health. They their thing is also they have resources on different things. They have surveys and statistics, and this survey was done in February, and they surveyed 1,000 Black Americans and 1,000 White Americans regarding experiences in the healthcare system. And let's see, I'm just going to go to the results. Okay, so basically, when they did this survey, they found that Black and White Americans use healthcare at nearly identical rates each year. I don't think they broke it down. Yeah, they didn't break it down by gender. So this is in totality. So we use healthcare at the same rates. 3 out of 4 of the total respondents reported they had seen a healthcare provider in the last 12 months, and they get a physical most years, but the experience of the healthcare system is not the same. The Black healthcare experience is having to navigate additional hurdles because of your race with the hope of receiving equal treatment. Now, there's one, you know, getting treatment is one thing, but getting treatment with dignity is what's making the difference. And that is what is um creating this mistrust, distrust, and then you end up with a disparity because if you're going to these healthcare providers and they're not being respectful, they're dismissing your pain, they're dismissing your symptoms, then you don't go back and then you end up with something worse. So that's basically what it broke down to. Let's see. Let me scroll down a little bit. I just want to touch on this and then we'll move to the next item I want to show. Black Americans in our survey report to being 10 percentage points less likely to have positive perceptions of doctors than white Americans, and 9 percentage points less likely to have a favorable view of nurses and physicians' assistants. Ooh, that's deep. And then, of course, they have a chart with the results. Let's see. Mistrust of the healthcare system exists among Black Americans, partly because of awareness in the racism of medicine. Um, Racist beliefs led to once accepted practices of medical experimentation on Black and enslaved people, as well as the exploitation of Black people for research without consent. And there's a whole bunch of information on that. Everybody knows the Tuskegee syphilis experimentation, but there's others out there as well. And that's a whole other that can be a whole other discussion. Um, let's see, and then um, and they give examples. There are a couple of examples of patients who have very bad experiences, Black patients who had bad experiences with white physicians and healthcare facilities. Um, then, according to the survey, 1 in 3 Black Americans reported experiences of racism while dealing with the healthcare system. Data from the Pew Research Center indicates that 71% of all Black Americans experience racism in any setting. So we're talking about just sitting in the doctor's office to being in the hospital trying to have a healthy delivery. Okay, and then they have this little chart of when usually experience racism, and of course the lowest is the follow-up call, and 52% said they experience racism during the appointment itself. People feel they're not listened to. The provider dismisses their symptoms or dismisses their pain, or they say something to the effect of, "Oh, you're not hurting that bad." So uh, the folks are most likely not to come back. Let's see. I read this before. There was something else. Oh, and this is actually referring to what I talked about earlier. Um, Responding to racism in healthcare can force Black patients to choose between basic respect and continued care. So the majority went and saw another healthcare professional. So at least they still tried to get care, but they ended up going somewhere else. Then the next was delayed making a health decision. and that's tied with didn't make a follow-up appointment. So they went to the first appointment, probably got a prescription or whatever, and didn't go back because they felt they were mistreated. 24% stopped getting treatment, so they're probably going in for some kind of health condition that was found at the original visit but didn't go back. 22% called out the offender, and that's tied with continued as if nothing happened, but only 8% did nothing. So the majority of the response by the patients was either they saw someone else or they didn't go back, or unfortunately, some didn't even bother to continue treatment, mm, um, which is not good, especially if there's a condition that you're being treated for. An interruption, as they say, an interruption in care can have consequences. So you're better off, even if you switch to another provider, you're better off switching to another provider, at least to continue the care that you started. Okay, so I'm going to stop sharing this. I'm going to bring up, let's see, and for the fellas, okay, I'm going to close that. Let's see. All right, so I'm going to show this next article, and let me share the screen. And yes, you are watching. Oh, okay, this is the one. You are watching the Eclectic Experience. I am your hostess, hopefully with the mostest. I am Shy Rosalind, and tonight we're talking about black health care for the fellas. And I'm going to. I showed one source, that if you want a black doctor, there is the blackdoctors.org. You can go there and punch in your zip code, and it will help you find a African American physician. And I showed a little background on the problem itself, why black men are reluctant to go to the doctor. Um, and I just showed some statistics on racism and in general within the healthcare system in the United States. And I just want to this does not have a video. Okay, but that's fine. I'm pulling up, this is from NPR. It was last year. This is from May of 2021. And as the title says, education usually improves health, but racism within the healthcare system sabotages most of the benefits of black men. And they interviewed Thomas Leviste, I guess I'm saying his name right, a sociologist and dean of the School of Public Health at Tulane University. There is a video of this interview somewhere, and I thought I had it, but if y'all can find it on YouTube, go find it, go watch it. So basically, they interviewed him, and he said, while in general, we have more education. We are getting better jobs. We're getting with health insurance. Most of us are trying to be healthier with our eating and exercising. But, and it's a good thing. But black men, with a college degree or higher, have a better life expectancy than those who may or may not have finished high school and not gone further. Um, but of course, for those of the Caucasian persuasion, um, it's almost equal to a point, and then it's not. the disparity just stretches out. Um, Black men are more likely to die from chronic illnesses like heart disease, diabetes, and cancer. Average life expectancy is lower. And they're, when they looked further into it to see what was causing the disparity, because black women tend to have a longer life expectancy than black men. So they were trying to figure out, okay, what is the thing? And even though black women experience racism in the healthcare system, and it's not just the patients, black professionals that work in the healthcare system are also experiencing racism in facilities and in practices. So it's actually going both ways. And there's a video on that I found. Maybe that can be like a follow up to this whole series. This is turning into a series, folks. So there are little follow ups that we can do here and there if you all are interested. So basically, the one thing they found is racism. Um, Black men generally don't like going to the doctor to begin with, and then when you go to a doctor that doesn't treat you with respect and dignity, they don't go back. They don't bother getting anything else checked out, and then all of a sudden they're in the emergency room. So, I'm trying to see if there's anything else. Okay, here's a quote. No matter how far you go in school, no matter what you accomplish, you're still a black man, said Derek Novacek, who has a doctorate in clinical psychology from Emory University and is now at UCLA researching black and white health disparities. So let's see. And it also refers to depression, which I'm going to bring up. There is a mental health. Actually, let me close. I'm going to close this out. Y'all can find it if you want. There is yes. Let me bring this up because I promised I'd bring up some resources, and I'm going to bring up another one right now. Where are you? Here we go. So there has been a lot of talk about mental health, especially in the black community, and folks, what can we do about it? And here is a source for you. It's the Black Therapist List. You can search in Canada or the United States. You can search by the particular issue. You can search by city or state, and it will give you a list. And I'm going to show you. I'm going to do it. City or state. I'm going to put New York, New York. Find therapist. And let's see what comes up. And no, okay. All issues. Search by age range. Okay. So we're gonna search by age range. Let's see what adult comes up. I wonder if it's only Canada. That's weird. It says United States, so let's see. I'm gonna take out the New York. I'm just gonna put New York and see what happens. I wonder. Okay, it was supposed to be the Black Therapist List, but I don't see. It's supposed to work. Okay, let's see. How long have they been around? It was created in 2020. It was created in Canada. Okay, so I think if I had chosen Canada, I probably would have found a few. So It's still a resource though. Um, and I think I actually have. There's another one, blackmailtherapist.com. Okay, give me 1 second. Stop this one. And I'm going to try and find blackmailtherapist.com. Okay. Oops. If I could spell therapist. Now there's supposed to be blackmailtherapist.com. And come on. There. Oh, okay. Here we go. Let's see. This actually might. Okay. Here's one. And I'm going to share that bad boy. Let's take a look at this gentleman here. I think this might be a better source. Yeah, here we go. So, yeah, cookies, whatever. Okay, so, we have therapyforblackmen.org, O-R-G. And they have find a therapist. Let's see if this one works. Find it. Oh, okay. They have actually, as of November 15th, Therapy for Black Men has been able to provide $70,000 and counting to sponsor free therapy for our men nationally, thanks to the kindness of our donors. Yeah, I figured there would be a wait list, but yeah, there's now a wait list for those seeking financial assistance. So, but you can still get they still have resources. Um, they have coaches as well as therapists showing here. Let's see. I'm going to do find a therapist. Let me see what happens. Therapist name, country, obviously United States, licensed in New York. And let's see what pops up. And oh, okay. So there's quite a few here. So yeah, definitely a source. Therapyforblackmen.org. So definitely check them out for a resource. And blackdoctors.org. And of course, I mentioned them last episode, Men to Heal. They have a YouTube page. I'm going to show it again. Let's close that. Close that. Close that. That. Let us go. Let's see. I'm going to find Men to Heal real quick. I want to show them again. They also, it's a mental health resource. There we go. Men to Heal. And, yep, perfect. Found them. And I'm going to share his page one more time so you guys can see. Men to Heal. Boom. So here we go. Another source for mental health. he has some educational videos here, and their website is there, so you can reach out and look them up if you want specific information. So please go there. Like I said, I mentioned them last time. So if it's something you're interested in, please go to his page and go to his channel and subscribe. And let's see. Let me just search something real quick. Bear with me, folks, because black man. Nope. Black men healthcare. Okay. I think there was. Yeah, as you can see, there's a bunch of discussions regarding including me that's popped up. Um that has a bunch of sources. There's a lot of background information that you guys can check out. Um, there's a lot of self care and mental health for Black men. That information is now popping up to the forefront. So I would encourage brothers to check it out. Um, and a lot of it is mental health right now, but I would encourage y'all to try and find a primary care doctor first, as the reporter stated in the as the reporter stated in his report. um the best thing to do is to try and find a primary care doctor first, because especially with certain insurances you have to get a referral anyway. So your best bet is to go and find a primary care doctor, get a full checkup, get your blood work, get everything checked, um, see if there's something going on physically that you need treatment for before, and let your primary care doctor kind of steer you in a particular direction. They know what to ask, they know what questions to ask to determine what you need. So I would definitely encourage, Black men, y'all need to take care of yourselves. If you take care of yourselves, then if you keep yourself healthy, you can, that will help your family, basically. And not even just your family, it'll help yourself. If you are taking care of yourself and your health is good, there's that saying, health is wealth. If you're not healthy, you're not in a good position. You're not in a good place. Um if you are taking care of yourself and you are healthy, you can do more. You can enjoy life more. Yeah, racism is in the healthcare system. I mean, it's there. But so that means, we got to do a little extra work to find someone that can be respectful and treat us with dignity. Um hey, how are ya? Hey, Miss Cece, how you doing? I was just about to start wrapping it up. But I'm glad you stopped by. I'm glad you're here. I was just basically, tonight's presentation was just talking a little bit about the statistics behind the why our brothers don't like going to the doctor, and why they don't like going to the doctor, and some of the background behind it. And there is legitimate reason, because unfortunately there is racism in the healthcare system. We have to navigate a little bit more than our Caucasian counterparts. And I was just saying that that oh yeah, yeah, please catch the replay and feel free to share with a friend or two or three. Um and I was just saying that, health is wealth. If you are healthy and your body is in good shape, then you will be able to and be able to enjoy life a lot more. And you'll be more present for your family if you're feeling good. And that's why I'm trying to, just in my own little way, trying to encourage black men to, yes, it's going to take a little bit more work, but find a doctor you can trust. Ask ask your, if you're dating a girlfriend, ask your girlfriend, hey, who's your doctor? If you got friends in the barbershop, chit chat in the barbershop. Yo, I need a doctor. Who you use? You know, um, do it that way if you have to. Go that route. As a matter of fact, my former boyfriend, may he rest in peace. Unfortunately, he did pass, but he, was complaining. He had a cough. He had this. He had that. And I'm like, dude, here's the number to the clinic I go to. Here, call them up. Um, See who they assign you to. Obviously, they didn't assign us to the same doctor because we were in a relationship, so they don't do that. But he was able to go and see my doctor's partner, and they did a whole workup. He ended up in the hospital. They did a whole workup, and if I hadn't encouraged him, yes, yes, exactly. I mentioned that earlier. One thing I tell people, that it's okay to fire your doctor if they don't meet your needs. Absolutely, absolutely. As a matter of fact, some of the statistics I pulled up, the survey mentioned that 22% of the people black folks they surveyed, said that they left the provider and went to another provider. So people are doing that. They will vote with their feet and find another provider. And the other 22% went to another provider, and another 22% actually called out the provider they were seeing and said, hey, you're not going to treat me like that. So, folks do stand up for themselves, which is good. It's a good thing. um like I said, I'm just trying to encourage people, especially our brothers, to you're gonna have to fight a little bit harder to get the care that you deserve, but you should get it. We all deserve to be treated properly, and we all deserve to have a good doctor, good medical team if we need it, and we deserve it. Period. Especially if you're paying for insurance, or your job is paying for insurance, and you should use it. I mean, it's you've earned that benefit, so why not use it? And yeah, if you got to change your doctor, change your doctor. If you're not happy, let them know. Hey, I ain't happy. I took my mom to an eye doctor. They told me they took her insurance. And I asked them 3 times if they took her insurance. They said yes. I took her to the eye doctor. Oh, we don't take this insurance. I got so mad. I didn't raise my voice, but they knew I was angry. And we ended up paying out of pocket for the eye doctor because we were stuck there basically. And it turns out the eye doctor that she did see, the person was very nice, very gentle with her. And if it weren't for the front desk, it would have been a very good experience. So, and it was a black doctor that we saw. And, yeah, it just, it varies. But, I think I've presented everything I wanted to present for tonight. Miss Cece, thank you so much for stopping by. I really appreciate it. Yes, do catch the replay. And you'll be able to see the statistics and stuff I presented. And thank you everyone who's going to be watching in the replay. I do appreciate y'all. My new subscribers, I do appreciate you. Thank you so much for coming by. Um, Please, like, subscribe, tell a friend or two or three, spread the word. I reached a milestone on YouTube. I have 100 watch hours, so somebody's watching my stuff. And I do appreciate everyone who does. Tomorrow night is hopefully Beat in Chat. I'm hoping. I'm not sure what the project will be because Her Majesty messed up my desk. And that is a story I will tell tomorrow night on Beat in Chat. But um, thank you, Miss Cece. That is a story I will tell tomorrow night on Beat in Chat. My mother messed up my work desk. Beads scattered. I don't know what she was doing. She snuck in there in the middle of the night and messed up my stuff. So I'll talk about that tomorrow night. And maybe that's what we'll do tomorrow night. Tomorrow night will be organization of my beating desk. So I hope to see you all there. I have it scheduled for 9:30 tomorrow. I'm hoping to do it a little earlier. But we shall see. So, on that note, thank you all for joining me tonight. This has been the Eclectic Experience. I am your hostess with the mostest, Shy Rosalind, and I hope everybody has a wonderful weekend. And I will hopefully will see you all again tomorrow night. Miss Cece, thank you for stopping by, and I'll catch up with you on IG. Take care, everybody.